धन्यवाद दिन चाहन्छु सबैजनालाई तपाईहरुको उपस्थितिको लागि। आउनुहोस् हामी सुरुमा चाहिँ पहिलो प्रार्थना गरेर चाहिँ हामी आजको यो कार्यक्रमलाई सुरु गर्नेछौँ। महान जीवित अनि दयालु परमेश्वर बुवा, हामी तपाईलाई समयको लागि धन्यवाद दिँदछौँ। साथै फेरि पनि हामीलाई यसरी सँगै भेला भएर प्रभु तपाईको अगाडि आउन अनि साथै यी ज्ञानका कुराहरू सिक्न सिकाउन प्रभु तपाईले हामीलाई यो मौका दिनुभएको छ। साँच्चै प्रभु हाम्रो यो कार्यक्रममा सुरुदेखि अन्तिमसम्म तपाईँ हाम्रो बिचमा हुनुभएको होस्। आजको स्पिकरलाई पनि प्रभु हामी तपाईँकै हातमा सुम्पदछौँ। त्यस्तै जो आउँदै हुनुहुन्छ उहाँहरूलाई अनि जो अलरेडी हुनुहुन्छ प्रभु उहाँहरू सबैजनालाई प्रभु तपाईँको हातमा सुम्पदछौँ। प्रभु साँच्चै तपाईँको उपस्थिति अनि तपाईँको राज्य विस्तारको काम प्रभु यसद्वारा हुन सकेको होस्। प्रभु धन्यवाद तपाईँलाई सबै कुराको लागि। सबै आजको यो संगति कार्यक्रम तपाईँकै हातमा सुम्पदै आशिष अनुग्रह माग्छौँ प्यार प्रभु येशू ख्रीष्टको नाममा। आमेन आमेन। हुन्छ हुन्छ। सो आई गेस आर वी गोइङ टु वर्शिप। आजको वर्शिप हामी सुरु नै गर्नेछौँ अनि त्यसपछि चाहिँ हामीलाई अशोक दाइले आजको स्पिकरको इन्ट्रोडक्सन हामीलाई गराउनु हुनेछ। हुन्छ हामी केही गीतहरू गाएर सुरु गरौँ है त। हुन्छ। हामी जब ल्याउँछु भन्ने यो हेब्जिबा ब्यान्डको असल मित्र भन्ने कोरस गाउँदै परमेश्वरलाई समय धन्यवाद दिनेछौँ। अनुभव गर्छु उपस्थिति तिम्रो मेरो जीवन छोडिदिने मेरो हृदयलाई सगाई गर्ने मेरो जीवन छोडिदिने मेरो हृदय सगाई गर्ने असल मित्र तिमी असल मित्र असल मित्र तिमी असल मित्र अनुसार हाम्रो समय सबैजना आफ्नो मुखहरू खोलेर परमेश्वरलाई धन्यवाद दिन्छ। प्रभु साँच्चै हामी तपाईलाई यो समय धन्यवाद दिँदछौँ। हामीलाई फेरि प्रभु यसरी सँगै भेला भएर तपाईलाई धन्यवाद दिन तपाईलाई आराधना गर्न अनि साँच्चै सिक्न अनि सिकाउन प्रभु तपाईले हामीलाई यो मौका दिनुभएको छ। तपाईलाई धेरै धन्यवाद। धन्यवाद यो फेलोशिपको लागि। धन्यवाद हाम्रो साथमा प्रभु तपाईँ हुनुभएको लागि। साँच्चै हरेक परिस्थिति थ्रु थिक्स एन्ड थ्रु थिन्स लर्ड तपाईँ हाम्रो साथमा हुनुहुन्छ हामी जान्दछौँ। हामीलाई प्रेम गर्नुहुने परमेश्वर, हामीलाई वास्ता गर्नुहुने परमेश्वर प्रभु तपाईँ नै हुनुहुन्छ। यस समय हामी तपाईँलाई धन्यवाद दिँदछौँ। हामी तपाईँको अगाडि हाम्रो शिरहरू झुकाउँदछौँ अनि हाम्रो हृदय त प्रभु तपाईँको अगाडि ट्रान्सपेरेन्ट नै छ। प्रभु तपाईँ सबै थोक जान्नुहुन्छ। हामी सबै प्रभु तपाईँको अगाडि हाम्रो शिरहरू झुकाउँदछौँ। हाम्रो शब्दहरू, हाम्रो जिब्रोहरू, हाम्रो विचार, हाम्रो व्यवहारद्वारा प्रभु यदि हामीले तपाईँको चित्त दुखाएका छौँ, एउटा असल विश्वासी, एउटा एक्जेम्पलरी जीवन प्रभु यदि हामीले जिउन सकेका छैनौँ भने आज हामी तपाईँको अगाडि क्षमा माग्छौँ प्रभु। लर्ड, आज हाम्रो यो ढुङ्गाको हृदयलाई प्रभु तपाईँले मासुको हृदय हालिदिनुहोस्। धन्यवाद। तपाईँ बिना हामी कोही पनि होइन प्रभु। धन्यवाद, हाम्रो साथमा तपाईँ हुनुहुन्छ, हामी जान्दछौँ। साँच्चै प्रभु बाँकी समय सबै थोक प्रभु तपाईँकै हातमा सुम्पन्छौँ, तपाईँकै पाउमा तपाईँ आउँदै आशिष अनुग्रह अनि ग्रेस माग्छु येशू प्रभुको नाम। आमेन आमेन। धन्यवाद सबैजनालाई आराधनामा सहभागी हुनुभएको निम्ति। सो अब चाहिँ म यो समय हाम्रो अशोक दाईलाई दिन चाहन्छु। उहाँले चाहिँ हाम्रो आजको स्पिकर माया दिदीलाई चाहिँ प्रपरली इन्ट्रोड्युस गर्नुहुनेछ है त।
धेरै धन्यवाद जी बहिनी, हामीलाई राम्रो गीत गाएर आराधनामा लानुभएको निम्ति। अनि आजको हाम्रो प्रेजेन्टर चाहिँ हाम्रो माया बहिनी। मैले माया र अर्जुनलाई कोलम्बसमा भेटेको, त्यही द्याट्स द सेम टाइम हाम्रो पास्टर दिल्ली र उहाँको परिवारलाई पनि मैले पहिलोचोटि भेटेको। उहाँको घरमा, उनीहरूको घरमा मैले डिनर खाएर हाम्रो पास्टर दिल्लीको घरमा म सुत्न गएको। द्याट्स माई मेमोरी होइन। कोलम्बसमा आई थिङ्क 2013 or 14, त्यो 14 होला होइन। अनि त्यहाँदेखि चिनेको। अनि माया बहिनी म्यारिड with Arjun Bhai and 2 beautiful and super energetic daughters. and Maya Bhai चाहिँ career wise चाहिँ she's in nursing and then nurse practitioner, correct position, and now she has been working I don't know for the last how many years in Jericho community health center. Is it the proper name? Yeah. अनि बफेलो न्युयोर्कमा। अनि अनि अर्जुन भाइ, माया बहिनी, and they have really a missional perspective होइन। आफ्नो हेल्थ करियरलाई, हेल्थ प्रोफेसनल करियरलाई लिएर चाहिँ कसरी चाहिँ अझ एक्टिभली चाहिँ परमेश्वरको राज्यमा चाहिँ सेवा गर्न सकिन्छ भन्ने उहाँहरूको ध्येय छ। अनि माया बहिनी त्यो जेरिकोले उहाँ आई थिङ्क वाट इज सिन्धुपाल्चोक, इज सिन्धुपाल्चोक उहाँ चाहिँ एकदमै रिमोट एरियामा एउटा हेल्थ सेन्टर सुरु गरेको छ। अनि त्यसमा चाहिँ माया बहिनी सुरुदेखि अहिलेसम्म एकदम एक्टिभली इन्भल्भ हुनुहुन्छ। एन्ड who knows, in future maybe if God opens the door, they might be even willing to move to Nepal and then serve the एकदमै marginalized community on the health sector. Okay. अनि आज हामी माया बहिनीको एकदमै धेरै अनुभव छ। माया बहिनीलाई यो क्षेत्रमा अनि आफ्नो एउटा काम गरिरहेको एउटा अनुभवलाई सँगालेर बटुलेर चाहिँ एकदमै हामीलाई चाहिँ चाहिने राम्रो चाहिँ फङ्सनल मेडिसिन सम्बन्धीमा चाहिँ माया बहिनीले चाहिँ आज हामीलाई सिकाउनुहुन्छ। आउनुहोस् हामी सबैजना ताली बजाएर माया बहिनीलाई चाहिँ वेलकम गरौँ। गुड,
थ्याङ्क यू सो मच। म पहिला सुरुमा स्क्रिन सेयर गरौँ मलाई। Hello, can you guys hear me?
Yes.
Okay. Right. Share screen and share Okay, there you go.
Hello, Jyoti Baini, welcome.
नमस्ते
Namaste. Wow.
Namaste.
बाहिर थियो हजुर नमस्ते माया नमस्ते everyone
Thank you for coming. All right. So
absolutely looking forward to
Are you driving, Jyoti Mani?
no I'm outside there हजुर
Oh, yeah, okay.
okay. So quickly, are you guys seeing my screen and then hearing me well?
Screen share भएको छैन अहिलेसम्म.
Okay.
अघि त एकछिनै भएको थियो के भयो?
Oh yeah. Okay. Share screen. Now?
No. Okay, finally.
Yeah.
Yeah.
Okay. Awesome. Okay. Good. All right. So you can hear me and see my screen, right? Okay. Can you hear me?
Oh.
And see my screen? Hello?
Yeah, everything is okay.
Okay, good.
yes
All right, awesome. So hello everyone, and thank you so much, Asuktai and NSCSP team for giving me this opportunity. I need this PC. So welcome and thank you everyone for joining as well. So today we'll be talking about functional medicine, the root cause approach to health and illness. So today's objectives are what and why of functional medicine, a little bit of my story about why I transitioned to functional medicine, and how this model is different from conventional approach, and the different approach to patient illnesses and labs, and also to make you a little bit wiser and smarter patient by the end of this presentation. I will be also sharing some patient success stories and some tips for healthy living. Here's my disclaimer. The content of this presentation is not for the medical advice, but for the educational purpose only. And then the picture slides are credited to IFM, Institute of Functional Medicine. That's where I got my further training about functional medicine. So yeah, let's define functional medicine. So functional medicine is the model that is dedicated in understanding the root causes of illness and also restoration of health and well-being. So, the picture here is like the iceberg, right? So we are not just looking at the tip of the iceberg, but also the root all the way down of the iceberg. So, so the functional medicine, like really trying to understand the root cause of illness, especially this. When we say the illnesses, we are especially looking into the chronic illnesses, like for many, many years or many, many months too. And then restoration of health and well-being. So in functional medicine, we address the whole person, not just like the symptom-based. So we are really looking at individuals' physical, emotional, spiritual, environmental, social aspect, all of those things. This is very upstream. So we are looking, we are going from the root to the up. So it's the upstream way of, approach, and it's a very much scientific, biological, biology-based approach. And then we consider complex web of interaction and influences of patient history and lifestyle and all the body systems. And then we also integrate the lifestyles, which would be your, nutrition, your exercise, your relationship, the toxins and all of those, and also use advanced lab testings. Those will be, more than just a traditional lab. So, just in a nutshell, this is what functional medicine is. So we're gonna rethink, here in, especially in the Western country, we have to rethink the type of, and how we are getting the care. We have to rethink the type of care we are receiving if we are a patient And then also rethink if, the type of care we are giving to the patients, if you're in the healthcare field, because, like how many of you, like, feel so like ill, right, for the longest time, and you go to the doctor and then the clinic does some blood work, some maybe imaging, and they say everything is normal. And but in the reality, you're still not feeling well. And then, just think about maybe your friends or even your mom, like she's been having this abdominal pain, stomach pain for the longest time, and you do all kinds of tests, right? The blood work or the stool test or a colonoscopy, all of those, and things come pretty normal, and but she's still having pain, and maybe she's given some like omeprazole or some ibuprofen for pain or discomfort. And so, there are like some things that the conventional way of medicine has not been able to address. And this is where a functional medicine model comes in to really take us to the next level of care. Now, don't get me wrong, we do need, conventional and all kinds of, healthcare, right? The specialists and all of those. If I'm having heart attack, please do not take me to the functional medicine practitioner. Please do take me to the emergency room. If I need any surgery, then I do need surgery, right? But when all the healthcare professional, when we are working together in collaboration, is a beautiful and excellent thing for the patient, for the excellent care. So I really focus in the collaboration and all of those parts. However, the reality is we have a broken system, broken healthcare system, and where a lot of our the care has been influenced by the pharmaceutical companies and insurance company. A lot of the doctors and all the nurses, they go to all this schooling with the hope and desire to really help patients, right? But what happens is that once we are in the work, we have limited time, and everything we decide, or our decision making for the patient care is very much influenced by this insurance and pharmacy and all of those things. And so because of that, healthcare providers, unfortunately, even though they really want to help, they are not able to, they don't have time to really, listen and really dig deeper in why patient is, having this illness. And also like giving education, not just like listing out, eat healthy food, but also a little bit going deeper. And that's what the reality is. And so we gotta like rethink again what kind of care we are receiving. And my goal is really to, because the functional medicine model has been there, but I think it's kind of new for a lot of people, including a lot of the professionals too. And my goal is to really kind of give you the general overview of what this model really looks like, and if this would be of any help for you and me and our our family, maybe now or in future. So hopefully that's going to happen. So how is it implemented? So how do we really use this? We really like spend time with patients. So, we spend probably 1 to 2 hours in the first visit, and the follow-ups would be like 30 minutes, 45 minutes, or 15 minutes, depending upon, why. So we are really trying to go back to the timeline when the patient, was a baby or like even in the womb, and really looking into any genetic components, any, sickness, like how much of antibiotic intake, what kind of medication, any trauma, social or family relationship issues, any divorce going on in the family when they're growing up, bullying, like all of those things, because all of those aspects does, affect your health. And then, like the matrix is basically these different organs, like, how we have we have different organs, let's say thyroid or your stomach or kidneys and your, heart and all of those. So, those are the organ systems affected. And most of the time, when it comes to chronic illnesses, a lot of the systems are involved, not just one. And so we are like really looking into all of those. And also, we also look into something called antecedents, triggers, and mediators. That really means like during that time, okay, so like when individual have certain illnesses, symptoms going on, then we're looking at what really triggered, like, is that like stress? Was like the work being very stressful? How was there any chemical exposure? Was there any like foods that you were allergic to and or sensitive to and you kept eating? Was it like certain travel to other countries and had some kind of infection, like or use of certain medications, or it could be like a lot of things. So we really dig into all of those. And so we also do like common but also advanced labs, and then really heavily focus on lifestyle modifications, which we'll talk more, and really try to remove the things that is really hindering, in healthy lifestyle, whatever is hindering, and add some of the things that would be helpful and be needed. So we'll talk more about that. But this is just like in a glance, this is what exactly we are doing, so that we can really get into the root cause of the condition. So I really like this the functional medicine tree model from the Institute of Functional Medicine. And we can look at a person and compare it as a tree, right? So in a tree there are like roots, and then the main, the stem, and then the branches and the leaves and the fruits. And so for us, human body, we are in the same way. And then for the tree, the root has a lot of influence, right? So, and a lot of functions too. If the root is not very healthy and it's not doing function in terms of getting nutrition, in terms like here it's going to be your maybe water or fertilizer, or like and then sunshine, all of those things, right? So it's really affect the fruit and the health of the tree. So in the same way for human body, when we say that the root causes, we are really looking down into the lifestyle and the environmental factors. So that could be and this could seem like very simple, but it has so profound impact in our health. So, like we are really looking into your sleep and relaxation, like, okay, sleep, but then do you have like relaxed time, right? And then how's your environment? How's your exercise, or your stress? How's your relationship, and then we also consider like any genetic predisposition, like your belief and attitude, as you grow up, like any factors that influence your belief, and also like mental and spiritual and emotional health. So we are like very much heavily looking into like mental, emotional, and spiritual. That's like the core that we look into. And then with all of these things, then it's going to really affect the different system organs. So this is how we look at things. So, and then the matrix, like I was saying, we look into the matrix, means like different body system. We do not isolate just one body system, but also like really looking into its interaction and relationship. So for example, let's say you are having some stomach issue, right? So and then what happens is like so there is a connection between your gut, like let's say stomach, and all the GI system, and also your brain. And if you guys might have heard about something called gut-brain axis or gut-brain connection. So if you're having stomach issues, it's gonna like really affect also your mood and like your brain, because like in your gut lining, there's like 70 to 80% of your happy hormone, the serotonin, the neurotransmitter is there. And so when you have GI issues going on, your lining has some issues going on, something called leaky gut, then your serotonin level is reduced. Now, because it's a happy hormone, when it's reduced, then you may have some mood issues like depression or anxiety, things like that. So a patient may come at just as for the stomach issues, but if it's going on for a long time, and then there is like depression on the side too, so this is very much connected. So then we really need to look into the patient's GI issues and not really, okay, here's your medication for depression, right? So that's not the really good way to do it. Same way, let's say like a patient is not really eating well for, whatever reason and has a very poor diet. And so now you're really making this, your cells, your mitochondria very hungry, right? So then mitochondria is this function of producing energy, the ATP. And so now you don't have energy, and so now you feel like very fatigued. So like eating and the GI, and then it's really going towards like even your cellular level. And same thing with your like diet and trauma or like emotions or stress. Everything is very much connected. And so this is where we really look into like holistically with this model. And this is the example. This, I was debating if I should put this like a slide or not, but I really want you guys to really look into and think that how powerful all these factors can be. Like your food antigens mean like, something that you may be allergic to that you may not even know. And I'm a proof of this, like, like I have certain food antigens, like sensitivity, and like I don't have anything symptom outside, but there was something going on that really affected my health with the food sensitivity test. That's what I was able to see. And then the stress, like stress. Oh, I think we already know, right? Stress can really affect a lot of conditions. And then any kind of infections or dysbiosis, which is imbalance of the bacteria, the microbiome in your GI system. Or like any kind of other diseases, or like your nutrition is not sufficient or taking other medications, all of those things can alter something called intestinal permeability, which is also say like leaky gut. And basically our gut lining, should be like very intact. There shouldn't be leaking, it should be very strong, very nice. But when it's like leaking, that means now like once it's leaking, that means like the antigens will go to your bloodstream, and then where does blood go? Pretty much everywhere, right? And so this can be like this simple thing can be also the source of your autoimmune or the systemic inflammation, systemic disease, if not taken care of in a timely fashion. So it's just like, these triggers can really hit you hard, if we are not taken care of on a timely basis. So again, like we want to rethink like about this, like, one disease, but it may have like many causes. If somebody is like have depressed mood, right, for a long time, let's say for 3 months, and then so the cure is not like giving antidepressant medication, okay, take this medication, but to really look into why you have depression. Let's find out, and is it the low thyroid, which is very, very common? Is it low vitamin D, which is really, really common? I've seen it all the time. Is it like other things like, like omega-3 fatty acid, which is, mostly found in fish? Is that the deficiency of that? Or is it like social isolation, or is it like, drinking alcohol and things of that nature that is really affecting your now gut system, or the antibiotic use or autoimmune? So depression, if it's like really profound, definitely should consider maybe giving medication short term, but we really want to look into what is the cause and trying to fix that cause, and hopefully the depression will subside once that has been taken care of. And we've got to rethink again, like there could be one cause, but it can lead to many diseases. And so the chronic inflammation is maybe one cause, but it can lead to many diseases. And so these days, like it's like heavily focused, like taking care of inflammation, right? So this lowering of inflammation has been like very huge these days, because and the inflammation really can cause and is one of the factors for a lot of these diseases, like your arthritis or cancer, or like your heart problems, or your autoimmune and diabetes and all of those things. So yeah, I mean, one of my goals is to make you a wiser and smarter patient by the end of this presentation, by just giving all these things, like giving you an insider view, right? So I'm just trying to encourage you to like really think about the root cause of anything that's going on in your health or your family's health, or even for the future. You may be healthy, most of you guys may be like young, but just learn, because these days a lot of professionals put out a lot of educational podcasts and videos. So learn and ask questions to your provider, primary or specialist, about the health, like the symptoms and why you're having that, and then also request. And so this is where I'm gonna go to the next section. So request the deeper dive labs. And so I think like this is a game changer for the providers, because we have these advanced labs now, and that has really helped us to find out what is going on with these patients. So even before going into the advanced lab, even with the traditional blood work, so this is where let's talk more about that. So in this, you can see there is in the left side, there is in the yellow section, functional low values, right? So it's a normal but not healthy. And then there is a green one, functional reference range, that's the optimal values. So in functional medicine, even the reference range for like certain things is like different. So in the conventional realm, I'll give you an example. Let's say for your thyroid, the reference range is 0.40 to 4.5. Okay, so if your TSH, which is one of the markers for thyroid, is like, let's say 4, then in the conventional realm, like, oh yeah, your thyroid is normal, you're fine, don't need to do anything. But from my perspective, what I will say is like, well, yeah, it's not optimal, and so there is a potential, you may go towards thyroid issues in the future. So let's try to see what things we can do to support your thyroid function. So in this, what this model will do, it'll be, so what are the again, like we are going back to those things, right? What are the triggers? How's your life, stress, all of those things. And then I'm also looking at what are the things that would support your thyroid. So in this case, I will be ordering some extra labs. It's very conventional, could be, some may or may not order these labs, but I'll be really looking into your iodine level, your iron, your vitamin D, your B vitamins, your selenium, your magnesium, your zinc, all of those things, because those are very, very important minerals and nutrients and vitamins for the normal, healthy thyroid function. So looking into that, and then really catching on before, storm comes, right? So, and then when we really supplement with those for a certain time, and we recheck, and then if it's better, then awesome, and there will be times if the thyroid is really needing some help, then thyroid medication too. But I'm just trying to give you a picture of even like when you're looking at some of the labs from your regular blood work, please do understand that there is a normal range and there is optimal values, and you want to be in the optimal. Another example I would like to give would be like something like, let's say, vitamin D, which I think like a lot of the providers are starting to order those. But for vitamin D, the reference range is like 30 to 100, and let's say your vitamin D level, when you did the blood work, was 35. So and the traditional provider may say, hey, yours is 35. You're within the reference range. You're good. All good. So end of the story, right? But then, from my perspective, it's going to be, well, yes, you are in low normal. I would really prefer you to be in 80. So that means like you gotta really work hard to, like get like to 80. And so like, enjoying the sunshine in the morning, and then really getting vitamin D, that will be more bioactive, like bioavailable vitamin D3 for a certain time, maybe take a break. So these are the ways that we really look into even the labs and how to address certain low values. And then like these days there are like so many advanced labs that we can order, like food sensitivity is one of like really good ones that's like easy, and it just gives you so many information. And if somebody is fatigued, then usually we do like adrenals, checking at your adrenal function. There's like we can do the stool test that really gives us a lot of information about your microbiome, and also any infections or digestive enzymes like our pancreatic enzyme, all of those. And then the urine with organic acid and hair analysis. So my point is, the medical field has advanced in so many levels, and these are available if we are like hopeless phase, and you are told that, oh, everything is fine, everything is normal, there's nothing needs to be done, but you feel like there's something needs to be done, and I would like to do something more. So there is hope, and there is resources, there are things we could do. I think that's where I'm getting into. And so I would like to share like a few of the patient success stories. So I had like about 40-year-old Nepali patient, and I got like one of the doctors transitioned her to me while I was like doing primary care. And so she was diagnosed with lupus, and she was going to the specialist, and she was getting the medication hydroxychloroquine, and also going to the eye checkup, because that could, if taken for the chronic time, like for the lengthy time, that can sometimes affect the eyes. So then I was like getting the training, and I wanted to implement. So I spent like an hour and a half with the patient, and really took like really good history. What are some of triggers, and what's going on in her life, what was going on in her life while in Nepal, all of those things. And had an idea like, okay, this probably is the way, is the cause. And I was able to do like the advanced lab tests as well. And so found out that like she had like a lot of food allergies and sensitivity, and she didn't know. And she had like a lot of like even environmental allergies, and especially to the things that she was living in the apartment, and it was not very helpful. And the mold, right? And she was also deficient in a lot of nutrients. And so we took out or tried to limit those things that was really hindering her health, and we added really good diet plan, and also added some supplements based on her labs for a few months. And she did really well, and she was very functional. She had like all those pains. In lupus, people have a lot of joint pains. I mean, there are different organs that affects the lupus, but she had these joint issues and wasn't able to like wake up in the morning and go to work. So she was like, after like, just, I think like, I don't know, like just few weeks or months, she was really very functional, no pain, didn't have to take any pain medication. And she really wanted to stop the medication given by the specialist. And I was still continuing to send her to the specialist. It's a collaborating care. And so yeah, she decided she would not take the medication, and so she did not take the hydroxychloroquine. And like I was really interested how she would do without that medication, and just with the supplements and other things that I recommended. And so she did very, very well. I mean, she was very happy, yeah, she was really happy with all of those. So, and same thing with, there was another 30-year-old lady, and she was diagnosed with rheumatoid arthritis, and we did the same kind of thing. And just very specific personalized care. It's very similar, and she did very well, and it could be like even the GI issues. Even like there was another patient I remember, he had like very severe like social anxiety and ADHD, and we did just like, okay, let's do just your food sensitivity, and he had many, and so he did like the elimination diet for 6 weeks, and in his follow-up he was like, yeah, I feel great, I feel very less anxious, and I feel young again. That was his word. So I mean, I mean, this is our health, and we will not have all the perfect, no disease, no pain kind of thing, right? Because this is just the fallen world. But and this model is not gonna like have, oh, you won't have pain, or you don't. But I think like if this is, this would be for somebody who is really suffering and tossed here and there in the health system, and there's just like better other options and hope. And so here are some lifestyle modification tips, and again, may sound very simple, but it's very, very vital for our ongoing health. Like a good sleep hours. So these are things that even if you're healthy, you keep doing, and focusing these things so that you prevent future illnesses. So good hours sleep, good sleep habit, reduce EMF, which is electronic magnetic field, especially. I mean, there are different kinds, but just even like your cell phones, your Wi-Fi. There are a lot of research going on and coming out with this, and so it really have like very much oxidative damage, and giving like free radicals in our body. So that's been a huge, and if somebody is snoring, then they do need to go see the sleep study, right? So and then nutrition. So mindful chewing, not being in the rush and chewing fast and swallowing, not going to be helpful. And then eating clean and organic as much as possible. And also the other question is, are you absorbing what you're eating, right? So you may be eating wonderful things, but then if you're not absorbing because of either low like digestive like HCl or other things. So, and are you sensitive to certain foods? You may not have like symptoms, but if there are things you feel like there's going on in your body, then it's worth testing. And then which diet plan is best, because there is no one thing fits for all. It's very personalized. But overall, like eating rainbow diet, like all colorful fruits and vegetables, as long as you're avoiding the allergens, is a good way to start. And exercise and movement, you already know that and its benefits. Stress management, right? So stress is huge. It could be just from the family or like work and relationship, all of those. And so, we go to God, in prayer for our stress. Walking and exercise, singing has been, there's a lot of studies says that if you're like really singing, that is really like very helpful as well for the stress. And also being able to say no when you are bombarded with a lot of responsibilities, right? So there's a balance. And relationship, like peaceful relationship and with God, spouse, family, friends, co-workers. I give this saying, forgive others not because they deserve forgiveness, but because you deserve peace. And this is one thing, I bring up with my patients especially in initial visit. And this is usually like, towards the end, this is the question. And I have so many patients, they just like break down and cry when I say, is there anything that, needs to be forgiven or ask for forgiveness? And people are really literally crying because that really, I guess like they are aware and they have not really addressed the issue of trauma or abuse or unable to forgive somebody, and that has really taken a toll in their body. So even this emotion has really a bigger trigger for your health. And so I had really, and this also gives me opportunity to share about God and, and just really, that's where I fall in, right? So this is a gateway for me to share if, I feel appropriate, and also pray and maybe give them a hug or something, because they're literally emotionally just down, and they're sharing, and I appreciate their sharing. And then the toxic burden, right? So we live in toxic world, indoor and outdoor, especially now we are all just indoors, and because of the weather, right? And so even with the makeups, it's a lot of all these things are very much hormone disruptors. So in a typical day, if a lady is wearing typical kind of makeups, she have close to 150 plus chemicals in her face. In the body, and whatever you apply in your body is gonna go through your system too from absorption. And same thing with, living in a very crowded city, or what kind of cleaning supplies you're using. You may be drinking good water from, and getting hydrated, but if you're drinking it through the bottled water, plastic bottle, then there's harm involved as well. So and so detoxification, so God made our body in a way that we would detoxify, or we would discard those things through sweat, or through lymphatics, or through urine, or through the stool, all of those things. But when there's heavy toxic burden from the type of environment we are living these days, our body does need help with the detoxification. And so detox is a lifestyle, it's a everyday process. And it's just through proper hydration, maybe like smoothies, or juicing, just eating healthy and more clean and organic as much as possible is it's as simple. You could also do, there are different detox things that the process you go through, chelation, or all of those things. But just to give an idea, this needs to be our lifestyle as well. And then I would also encourage you guys, if you don't know, looking into EWG, Environmental Working Group. They're very unbiased. They do unbiased research and publications, and giving you all the recommendation as far as anything the lotion, the let's say baby foods, or makeup stuff, or even the water, water filtration, all of those things is just awesome. So definitely check them out. You can also use that to scan the products, you know, when you go shopping. So yeah. And then supplements as needed. You know, healthy food is medicine. So our present food source, they are like very depleted in nutrition because of all the, you know, the soil erosion and all of those. So, you know, when needed, definitely supplement. That should be organic and non-GMO type. And supplements are not meant to be for a lifelong, you know, it's for maybe a few months or something like that. But again, you want to go to the basic of nutrition being the main thing. And then, so here are some of the books to read, some resources if you're, you know, interested on, you know, diving in more about certain things. Here are just some of the resources you can look into. I mean, just wanted to say that if you know, like just for the health and wellness of your loved ones, you could even like gift them the books. I have done it, you know, as a Christmas gift or birthday gifts, right? So they are educated more, or like, you know, gift them as maybe some kind of detox thing, or yeah, like even like a gift card for the supplement stores. I have done that for Christmas to some of the people. So yeah, and so I hope, you know, it wasn't too overwhelming of the information. My goal was really to give you, hey, there is such thing, such model where you may be you may have some answers to some of the, you know, questions, some of the root cause if you or your family is going through this. Because I work in the like I worked in the facility where we have like, I don't know, close to 40 providers, doctors, and, you know, nurse practitioner, PAs, and all of those. And I had to give this very similar kind of presentation because they were not aware of functional medicine. And then when I was taking care of my patients and providing functional medicine care, they didn't know what it is. So I had to like really explain what it is and what I'm trying to do and all of those. And, you know, it's a relationship and also commitment, you know, with the patient and the provider, right? So, I mean, patient also need to be committed to make some changes. Otherwise, it's not going to work. So hopefully that was of some help. And so thank you so much for this time. Happy health transformation. And if you have any questions, I'll try my best. Thank you.
Alrighty. Thank you so much, Maya. Didi, it was a very informative presentation. Honestly, I personally didn't know anything about functional medicine. Like, I've heard of Ayurvedics and holistic approaches, you know, but not a functional. Like, I didn't know there were like functional healthcare providers who like do this. So thank you very much. It's very new, but it was very informative as well. If we have now, we are going to the Q&A round. अनि यदि कसैलाई केही सोध्नु मन छ, तपाईहरुको केही प्रश्नहरु छन् भने, you guys, this is your time. यो टाइम चाहिँ म तपाईहरुलाई दिन चाहन्छु. सरी, मेरो रनिङ नोज भइरहेछ, त्यही भएर स्यास्या भयो. So yeah, let's ताली बजाएर चाहिँ आजको हाम्रो प्रेजेन्टरलाई हामी चाहिँ धन्यवाद, धेरै धन्यवाद यो टाइम अनि त्यसपछि यस्तो इन्फर्मेटिभ प्रेजेन्टेसनको लागि. Thank you so much. हुन्छ, यो टाइम चाहिँ तपाईहरुलाई दिन चाहन्छु. If you have any questions about the presentation today or any questions for our Maya Didi, for the presenter today, this is your time, है त. हुन्छ, हाम्रो हुन्छ, हजुर अनम्युट गरेर सोध्न सक्नुहुन्छ दिली दाइ.
सबैलाई जय मिसी छ अनि विशेष धेरै धन्यवाद हाम्रो मायाले मलाई यसरी अपडेट दिनुभएको लागि. हाम्रो यता बाइबल स्टडी भइरहेको छ, मलाई समय दिइरहेछन् र पनि मैले कोसिस गरेँ विशेष बुझ्नको लागि. कति कुराहरू त यो मेडिकल टर्म भएको कारणले बुझ्न सकिनँ. तर पनि मैले केही मात्रामा अलिअलि सेन्स गर्न सकेँ भन्छु हैन, धेरै भन्दिनँ, सेन्स गर्न सकेको छु। अनि यो हाम्रो लागि अति नै महत्त्वपूर्ण कुरा छ, जसरी हामीलाई स्पिरिचुअली हामीलाई जुन परमेश्वरको वचनले सिकाउँछ हामीलाई कसरी जिउने एउटा आत्मिक क्षेत्रमा भनेदेखि जो आजको मायाबाट आएको कुराहरू चाहिँ हामीलाई गुड हेल्थ हैन, हामीलाई कसरी जिउनु पर्ने अनि हाम्रो कसरी हाम्रो पुर्खादेखि नै आउने कुराहरू बिरामहरू सोध्ने यी कुराहरू सिक्न पाएका छौँ। धेरै धन्यवाद। मलाई लाग्छ यो हाम्रो के भन्छ त्यसलाई कम्युनिटीमा चाहिँ सम्भव हुनु भने चाहिँ यसलाई नेपालीमा पनि दिन सक्नु भए चाहिँ अझै राम्रो हुन्छ हैन। सायद यो कुन उद्देश्यबाट थियो मलाई अब बिचबाट यो गरे, मलाई एकदम मैले सबै कुराहरू त बुझ्न सकेको छैन, तर पनि यो हाम्रो बुवा आमाहरूले हैन, हाम्रो आदिवासी दाजु दिदीहरूले चाहिँ यसलाई यसरी बुझ्नु भयो भने अझै राम्रो हुन्छ होला। किनभने हामीले अहिले यो बेलामा बढी चाहिँ हामी खानेकुराहरू प्रशस्त भएको ठाउँमा छौँ र कुन कुरालाई खाने अनि कुन कुरालाई चाहिँ हामीले नखाने हैन, त्यसलाई ब्यालेन्स गर्ने कुराहरू चाहिँ मैले देखिरहेको थिएँ। अनि मायालाई धेरै धन्यवाद। मिठो एउटा हाम्रो लागि चाहिने जुन कुराहरू छन् त्यो कुराहरू अपडेट भएको लागि धेरै धन्यवाद। क्वेसन त त्यस्तो केही छैन, धेरै बुझेको भए धेरै क्वेसन हुन्थ्यो, थोरै बुझेको कारण मैले क्वेसन गरिनँ, तर म एप्रिसिएसन गर्न चाहन्छु। थ्याङ्क यू सो मच। हुन्छ, यो समय फेरि पनि ब्याक।
तपाईँलाई पनि धेरै धन्यवाद हैन, सुनिदिनु भयो। अनि अब त्यही अब पपुलेसन फोकस भएर अब नेपालीमा पनि भोलि पर्सि गर्न सकिन्छ यदि निडहरू त्यस्तो इन्ट्रेस्टहरू देखियो भने। हजुर, अनि अरूलाई पनि यस्तो कुनै स्पेसिफिक टपिकहरू त्यस्तो जान्नलाई यस्तो बारेमा पनि जान्ने भन्ने त्यस्तो छ भने पनि तपाईँले पनि च्याट बक्समा लेख्न सक्नुहुन्छ अथवा अनम्युट गरेर पनि भन्न सक्नुहुन्छ। त्यसले अब हामीलाई अझ अलिक बढी आइडिया, यो चाहिँ अब एकदमै धेरै ब्रड एकदमै जेनरल खालको भयो, त्यस्तो एकदमै फोकस केमा पनि थिएन मेरो हैन, तर भोलि पर्सि फोकस भएर गर्न पनि सकिन्छ इन्ट्रेस्ट देखियो भने।
मलाई पनि एउटा क्वेसन सोध्नु मन लाग्यो।
हजुर,
लाइक okay, this could be like very stupid, but is there like a different hospital or clinic where we go like functional medicine practice गर्ने डक्टरहरू या फिर नर्स प्र्याक्टिसनरहरू जस्तै हजुर जस्तै, do we just, is there like a different or just गुगल गरेर जाने कि how do we?
हजुर, यो चाहिँ अब सबै ठाउँमा हुँदैन। अनि यो हामीले जसरी पढ्यो होइन त्यसको एक्स्ट्रा ट्रेनिङहरू हामीले गरेको हुन्छ होइन। सो जसले गरेको छ उसले मात्र गर्ने हो। अनि अहिले चाहिँ अब यो फलाना ठाउँमा गयो भने चाहिँ हुन्छ त्यस्तो भन्ने छैन। अहिले चाहिँ मेनली आई गेस लाइक अब आफ्नो एरियामा चाहिँ अब गुगल गरेर फङ्सनल मेडिसिन प्रोभाइडर अथवा समथिङ त्यस्तो वेलनेस अथवा समथिङ त्यस्तै खालको टाइप गरेर चाहिँ भेटिन्छ। युजली अहिले यो इन्सुरेन्सले पनि त्यति कभर गर्नलाई मान्दैन कि। मैले पहिला जेरिकोमा मैले गरेँ होइन, 1 वर्ष मैले रिक्वेस्ट गरेर, अनि किनभने यसमा चाहिँ धेरै टाइम लगाउँछु कि होइन नेचुरली नै, अनि रिइम्बर्समेन्टहरू त्यति राम्रो दिँदैन होइन। अनि त्यही भएर उनीहरूले मलाई अब गर्ने अपर्च्युनिटी मेरो गयो, किनभने लाइक हुन्छ नि अब क्लिनिकले चाहिँ त्यो धेरै पैसा आइरहेको थिएन इन्सुरेन्सबाट। अनि सो त्यो अपर्च्युनिटी चाहिँ अब गुमाएँ मैले होइन त्यो क्लिनिकमा। तर अहिले म अर्कोमा गरिरहेको छु, तर मोस्टली चाहिँ त्यसरी नै हुन्छ, यो उसमा गयो भने भन्ने हुँदैन। अनि अब आफूले कलहरू गर्दाखेरि पनि अब सोध्न सकिन्छ होइन कि तपाईँहरूले फङ्सनल मेडिसिन मोडलले होइन यसरी काम गर्नुहुन्छ कि भनेर। कसैले इन्टिग्रेटिभ भन्ने वर्ड पनि युज गर्न सक्छ होइन। सो अब कस्तो छ उनीहरूको ट्रेनिङ तपाईँले बुझ्न सक्नुहुन्छ, तर त्यस्तै हुन्छ।
Okay, so thank you.
पास्टर दिदीले भने जस्तै हामी यो NSCSP को हाम्रो हेल्थ केयर ग्रुपको एउटा हाम्रो भिजन एउटा उद्देश्य चाहिँ हामी अहिले त जुमबाट तर पछि पनि रिजन सिटीमा चाहिँ लोकल चर्चहरूसँग मिलेर नेपाली भाषी कम्युनिटीलाई चाहिँ हामी हेल्थ स्वास्थ्य सम्बन्धी कसरी चाहिँ एजुकेट गराउन सकिन्छ ताकि चाहिँ हामी हामी चाहिँ एकदम अलि हेल्दी लाइफस्टाइल भएर जिउन सकौँ भन्ने हाम्रो हो है। त्यस कारणले तपाईहरुलाई त्यसो छ भने हामीलाई भन्न सक्नुहुन्छ अनि हामी जुममा अथवा चाहिँ इन पर्सन पनि हामी अर्गनाइज गर्न सक्छौँ है। ल एकदम धेरै धन्यवाद माया बहिनी, किनभने मेरो पनि आफ्नो एउटा पर्सनल इन्ट्रेस्ट हो हैन। हाम्रो रोग निको भन्ने कुरो चाहिँ एट द एन्ड अफ द डे इट्स रियली लाइफस्टाइल चेन्ज हो कि हैन। मेरो आफ्नै डाक्टरले पनि यताउति कोलेस्ट्रोल बढी भयो भने दिज आर थिङ यु निड टु चेन्ज, दिज आर द फुड यु निड टु डु, दिज आर थिङ यु निड टु चेन्ज योर लाइफस्टाइल भन्छ कि हैन। अनि म चाहिँ मेरो कोलेस्ट्रोल हाई छ अनि आई एम काइन्ड अफ लाइक अगेन्स्ट टेकिङ कोलेस्ट्रोलको केमिकल खाने अनि मल्ला जति खाने। मैले आफैलाई चाहिँ नो आई वान्ट टु चेन्ज माई लाइफस्टाइल इन इटिङ एन्ड आई वान्ट टु कन्ट्रोल माई कोलेस्ट्रोल भनेर मैले आफैले गरेको हो कि। त्यस कारणले इट्स अ गुड थिङ। नेपालमा पनि यसको पपुलारिटी एकदम बढिरहेको छ अहिले है।
हजुर
थोरै
सोध्नु मन लाग्यो एउटा कुरा।
हजुर
थ्याङ्क यू माया। मैले चाहिँ आई गेस लामै समय लाग्छ होला सबै बुझ्नलाई। मेबी आई क्यान have your time sometime. तर अहिले सोध्दा चाहिँ त्यो ल्याबहरू चाहिँ कस्तो लाइक you have your separate lab that you send out कसरी हुन्छ like if I like
हजुर जस्तो कि कति ल्याब त लोकली पनि गर्न सकिन्छ, तर अब समस्या के हुन्छ भने अब त्यो प्रोभाइडरलाई चाहिँ भनौँ न तपाईँको डाक्टरलाई चाहिँ अब यसको बारेमा त्यति नलेज छैन हैन, अनि भने चाहिँ त्यो इन्टरप्रेट गर्नलाई गाह्रो हुन्छ कि, किनभने अर्डर गरेर मात्र भएन, फेरि इन्टरप्रेट गरेर यो ल्याबले के भनेको हो अनि यो लाइक के हो भनेर अब भन्नु पनि सक्नु पर्यो हैन। अनि त्यही भएर कति डाक्टरहरूले चाहिँ रिक्वेस्ट गर्दा पनि गरिदिँदैन कि। जस्तै कि अब मेरै प्राइमेरी प्रोभाइडर भनौँ हैन, अब यो बफलोमा अब खासै धेरै छैन हैन फङ्सनल मेडिसिनको। अनि अब प्राइमेरी केयरमा अब एटलिस्ट ल्याब अर्डर गर्दै म आफै इन्टरप्रेट गर्छु भन्दा पनि हिचकिचाउँछन् कि, किनभने अब अर्डर त गर्यो तर इफ दे डोन्ट नो हाउ टु रिड वाट इट रियली मिन्स फर यु भने अब त्यो समस्या हो नि त। सो दे हेजिटेट। अनि अब यो एडभान्स ल्याबहरू चाहिँ अहिले धेरै छ हैन। सो देयर इज लाइक डिफ्रेन्ट वेज लाइक कि त अब एउटा चाहिँ फङ्सनल मेडिसिन प्रोभाइडरले नै गर्न सक्छ, अर्को चाहिँ देयर मे बी लाइक आई थिङ्क लाइक रूपा हेल्थ भन्ने छ, अरू छ पेसेन्ट आफैले पनि रिक्वेस्ट गर्न मिल्ने हैन। Things are being made easier for like providers like us and for patients like you. अनि जस्तो कि अब जेनोभा भयो अथवा डायग्नोस्टिक सल्युशन्स छ हैन, अनि ग्रेट प्लेन्स, like there are so many, they're like really looking into this advanced testing. अब के हुन्छ भन्दाखेरि अब तपाईँको ल्याब उनीहरूले अर्डर त गर्यो हैन, तर फेरि कसले इन्टरप्रेट गरेर हाउ टु डु केयर हैन। सो अल्टिमेटली यु वुड निड समबडी who can help you with all of those, not just like a lab order मात्र हैन कि, like really working with somebody with this kind of educational and training background would be helpful. And a good thing चाहिँ अहिले धेरै मान्छेहरूले रियलाइज गरिरहेछ कि, अनि who are somebody like who likes to really do this kind of detective kind of work and really holistic त्यस्तो खालको माइन्डसेटहरू अहिले धेरै बढी पनि रहेछन्. So I'm sure like even in Texas, in other places त्यस्तो मान्छेहरू धेरै प्रोभाइडरहरू धेरै आइरहेको छ. अब मोस्टली योहरू चाहिँ अब फेरि इन्सुरेन्सले कभर नगर्ने भएको भएर हैन, धेरैजनाले चाहिँ अब सेल्फ पे हुन्छ. सो द्याट्स लाइक अ बिग थिङ हैन, could be for many people. So I mean HSA कार्डहरू अथवा FSAहरू त्यस्तोहरू पनि लिन्छ. तर अब त्यही त अब होपफुली अब भोलि पर्सि इन्सुरेन्सले पनि हैन, इन्सुरेन्स कम्पनीहरूले नि यसलाई अप्रिसिएट गरेर त्यो गर्यो भने चाहिँ राम्रो हुन्छ. तर अहिले चाहिँ खासै धेरै नगर्ने भनेर प्रायः यस्तोहरूले चाहिँ क्यास बेस्डहरू गर्छ है. अनि म अहिले काम गर्नेमा पनि सी डज लाइक क्यास बेस्ड प्र्याक्टिस. अनि अब यसको रेन्ज कस्ट रेन्ज भन्दाखेरि अब इट डिपेन्ड्स अपन द स्टेट, तर मैले एभरेजमा चाहिँ लाइक 400 to 500 देखेको छु, तर आई हेभ अल्सो सीन लाइक 750 or 1,000 too. So it really depends which state and all of those things. That's even for that. तर अब यसको राम्रो कुरा चाहिँ के हो भने अब इनिसियल कन्सल्टमा अलिक धेरै लाग्छ होइन ल्याबहरू गर्नलाई अब कहिले काहीँ इन्सुरेन्सले केही कभर पनि गर्न सक्छ लाइक त्यो ल्याबहरू बट यु जस्ट निड टु फाइन्ड आउट अनि तर यो धेरै गइराख्नु पर्नेहरू पनि नहुन सक्छ कि लाइक यु नो इफ यु रियली डु एन्ड यु नो मेबी लाइक 1 or 2 follow-ups maybe and they're like really good with like all of those things unless like there are like so many you know chronic complex things going on and we really need to figure things out and we need more visits so that we can talk more and address you know a lot of things. But yeah, I've seen like people very frustrated with ongoing care and so they come to the clinic and they are happy and they are really making the investment for their health. So yeah.
Good.
Cool. एउटा question, sorry. Deepak दाईको Deepak बेनाको I guess mute on mute. Okay. दिली दाईले पनि अघि हात उठाउँदै हुनुहुन्थ्यो. You can go ahead. हजुर.
जस्तै मैले यो हालको जुन अहिले कुरा भइरहेछ नि माया त्यो चाहिँ ओहायोमा छ कि छैन भन्नलाई सोध्न लागेको थिएँ मैले.
ओहायोमा पनि छ ओहायोमा छ त्यहाँ गेहानाहरूमा छ हैन अब त्यो वेस्टरभेल एरियातिर पनि छ जस छ त्यहाँ
त्यो चाहिँ जस्तै मेडिकेटको कभरको कुरा थियो त्यस्तोहरू चाहिँ गर्छ गर्दैन भन्ने पनि एउटा प्रश्न
प्राय जस्तो गर्दैन मैले जानेसम्म लाइक खासै अब आफैले पनि सोध्न सकिन्छ हैन त्यही कुन क्लिनिकमा हो तर मोस्ट लाइकली चाहिँ I would say like 99% ले खासै लिँदैन अब यदि या लिँदैन अब जस्तो कि मैले एकचोटि लिइरहेको थिएँ तर we were in loss अनि मेरो क्लिनिकले मलाई गर्न दिएन.
अनि अर्को प्रश्न चाहिँ यदि गरिहाल्नु पर्दाखेरि कति कस्ट लाग्दो रहेछ भनेर पनि बुझ्नु.
गरिहाल्दा अब इनिसियल कस्ट पहिलो भेटमा अब सबैको डिफरेन्ट हुन्छ है मलाई भन्न सक्दिनँ तर अब जेनरली क्लोज टु अब अराउन्ड 500 लाग्न सक्छ हैन पहिलो भेटमा अनि त्यसपछि फलोअपमा तपाईको अब 30 मिनेट्स छ भने अब कम हुन सक्छ मेबी अब आई डोन्ट नो 250 300 लेला हैन त्यो क्लिनिकको पोलिसी अनुसार अनि अब कुनै बेला अब थोरै ल्याब मात्र अब गर्नु छ र त्यसलाई हेर्नु छ भने मेबी 15 मिनेट्स मात्र पनि हुन सक्छ अनि त्यसको त्यही अनुसारले पैसाहरु लिन्छ. तर अपफ्रन्टमा अलिकति धेरै देखिए तापनि लङ टर्ममा चाहिँ अब yeah it's a good investment for your health. त्यस्तो केही छ भने हजुर.
ओके. अर्को चाहिँ हामीले शरीरलाई स्वस्थ राखिराख्नको लागि चाहिँ व्यायाम अथवा एक्सरसाइज पनि अति नै महत्त्वपूर्ण कुरालाई मैले हेरिरहेको थिएँ त्यहाँनिर हैन जस्तै अब स्लिपलाई पनि हैन हामी जब सुत्ने कुरालाई पनि ब्यालेन्स गर्यो भनेदेखि चाहिँ त्यसले पनि स्वास्थ्य अलिकति राम्रो जान्छ भन्ने चाहिँ मैले त्यसलाई बुझिरहेको थिएँ. जसरी येशू ख्रीष्टले पनि लुका 2:52 मा परमेश्वरमा हैन अनि मानिस र कदममा बढ्नु भयो भन्ने कुराहरु छ नि र अनुग्रह कदम भन्ने कुराले चाहिँ मलाई हाम्रो डाक्टर रिसले ट्रेनिङ दिनुभएको थियो अनि त्यसबाट म लिँदै गर्दाखेरि चाहिँ एक्सरसाइज पनि धेरै महत्त्वपूर्ण रहेछ हाम्रो स्वास्थ्यका लागि चाहिँ त्यो तीनटा कुरा सबै कुरा ब्यालेन्स गरेर हैन परमेश्वर मानिससँग हामी राम्रो भयौं स्पिरिचुअल कुरा पनि राम्रो भयो तर हाम्रो गुड हेल्थ भएन भने चाहिँ काम नहुँदो रहेछ डिसब्यालेन्स हुँदो रहेछ अनि एक्सरसाइज पनि राम्रो हो भनेर उहाँले भन्दै हुनुहुन्थ्यो अनि यहाँ पनि त्यो कुराहरु सिक्दै थिए खुसी लाग्यो. थ्यांक यू.
अन्जेला दीपकले भनेको दीपक
जय सबैजनालाई म दीपक बल है म टेक्सासबाट अनि मेरो क्वेसन त छैन तर आई जस्ट एउटा कमेन्ट गर्न चाहन्छु हैन अनि एकदमै राम्रो टपिक है माया धेरै धन्यवाद समय मिलाएर हामीलाई शेयर गर्नुभयो अनि प्लस हामी सबैजना आई थिंक यो एकदमै हेल्पफुल टपिक हो हैन फङ्सनल मेडिसिन अनि एउटा कुरा चाहिँ हामीले मैले पनि एक्सपिरियन्स गरेको त्यो कुरा सायद यसमा सन्दर्भ हुन्छ कि भनेर मैले आई जस्ट वान्ट टु कमेन्ट अन दैट है हामी अब म पनि अब ल्याब साइन्टिस्ट भएको कारणले गर्दाखेरि हैन म ल्याब वर्क गर्छु हैन कस्तो भन्दाखेरि हामीले कति हाम्रो ड्याडी मम्मीहरू अथवा नेपालबाट भर्खर आउनु भएकोहरूले चाहिँ कस्तो भन्दाखेरि कतिचोटि चाहिँ ल्याब रिजल्टहरू जुन माइले टच गरेको थियो होइन ल्याब रिजल्टहरू हेरेर त्यो भ्यालुहरू ल्याउँछ होइन अनि यहाँ ल्याएर त्यो कम्पेयर गर्नुपर्छ क्या यहाँको ल्याबहरूसँग अनि त्यो कुरा चाहिँ हामीले बुझ्नुपर्छ किनभने रेफरेन्स रेन्ज भनेको चाहिँ जुन चाहिँ तपाईँको ल्याब नर्मल हो कि एबनर्मल हो भनेर त्यो रेफरेन्स रेन्ज निकाल्ने चाहिँ त्यो सर्टेन पपुलेसन हेल्दी पपुलेसन सर्टेन ठाउँको होइन बाट उनीहरूले स्ट्याटिस्टिक्स युज गरेर होइन 95% 96%हरू हेल्दीको चाहिँ यति रेन्ज हुनसक्छ है भनेर चाहिँ उनीहरूले त्यो निकालेको हुन्छ होइन त्यो चाहिँ क्षेत्र देश अनुसार फरक हुनसक्छ अझै इन्स्ट्रुमेन्टको आधारमा पनि फरक हुनसक्छ कुनैले फाल्टै इन्स्ट्रुमेन्ट युज गरेको हुन्छ कुनै फाल्टै त्यो हामीले ल्याब वर्कहरू चाहिँ कहिले पनि कम्पेयर गर्नु मिल्दैन होइन तपाईँ म टेक्स्टमा छु मैले टेक्स्टमा गएर मेरो हिमोग्लोबिन अथवा हिमाटोक्रिट त्यस्तो मैले त्यो मेजर गरेँ भने यहाँ ल्याबमा र त्यही कुराहरू अब कोलोराडोको ल्याबले होइन गर्यो भने किनभने त्यो कोलोराडो भनेको अलिक हाई एल्टिट्युडमा छ जसमा चाहिँ उसको चाहिँ युजली रेफरेन्स रेन्जहरू हिमोग्लोबिन हिमाटोक्रिटको चाहिँ भ्याल्यु हायर हुनसक्छ सो सोल्ली हामीले नम्बरको आधारमा चाहिँ हामीले त्यो डिसाइड गर्नु मिल्दैन होइन तर तपाईँले चाहिँ आफ्नो सर्टेन एरियाको त्यो रेन्ज चाहिँ युज गर्नुपर्छ अनि यो जस्ट मलाई लाग्छ किनभने मेरो आफ्नै ड्याडीको पनि भाइटामिन डी गर्ने बेलामा होइन नेपालमा यति भनेको थियो अनि यहाँ त्यति भन्दैछ भने अलिकति मिसकन्फ्युजन अनि उहाँले त्यसै त अब कति कुरा ट्रस्ट गर्नुहुन्न अनि त्यो कुरा पनि ल यहाँको त फरक हुँदो रहेछ अथवा नेपालमा नजानेको कि यहाँ नजानेको भनेर उहाँलाई पनि यसो कन्फ्युजन भएको जस्तो कुरा हो त्यही भएर यो चाहिँ एउटा टेक्निकल कुरा हो डिफरेन्सेस भनेको अनि हामीले त्यो बुझ्यो भने चाहिँ सर्टेन थोरै घटिमटी भएर कहिले पनि फरक हुँदैन तर तपाईँ सिग्निफिकेन्टली लोवर साइडमा अथवा हाई साइडमा हुनुहुन्छ भने चाहिँ तपाईँले केही चाहिँ फलोअप चाहिँ गर्नुपर्ने हुन्छ नभए थोरै कमी घटीले त्यो ल म त अब एबनर्मल भएछु अथवा म एकदमै लो रहेछु भनेर अलिकति क्वाइट भन्न मिल्दैन होइन किनभने डिफ्रेन्ट टेक्नोलोजी पनि हुनसक्छ होइन अनि म त्यही सेयर गर्न चाहन्छु अनि आई थिङ्क हामीले त्यही सिक्यो कि आखिर केही कुरा हुँदाखेरि तुरन्त मेडिसिनमा जाने भन्दा पनि हामी जहिले पनि चाहिँ होलिस्टिक एप्रोच जुन चाहिँ फङ्सनल मेडिसिन हामीले गऱ्यो भने चाहिँ जहिले पनि इट्स अलवेज हेल्पफुल क्या किनभने तपाईँलाई इमर्जेन्सी पऱ्यो भने सर्जरी गर्नु पऱ्यो भने जस्तो मायाले भने जस्तो त्यो बेलामा इमिडिएट निड चाहिन्छ तर कति हाम्रो प्रब्लमहरू शरीरमा भएको प्रब्लमहरू चाहिँ कस्तो हुन्छ भन्दाखेरि इट्स अल आवर लाइफस्टाइल हामीले जे खाना खाइरहेको छ स्पेसली यो देशमा त तपाईँको फुड इज वान अफ द वर्स्ट थिङ है यहाँ त कुनै खाने चिजै यहाँ छैन भन्छ साँच्चै भन्ने हो भने होइन यहाँ त पुरा गाउँमा बस्ने कन्ट्री साइडमा बस्ने मान्छेहरूले मात्रै उनीहरूले आफ्नै अन्नबाली कुखुरा अन्डाहरू खाएर उनीहरू बस्ने त्योहरू मात्रै अलिक केही खाएको कि लाग्छ तपाईँ होइन भने त यहाँ हामी बसेको सहरमा बस्ने मान्छेहरू हामी हुन्छ नि खाना खान्छौँ फास्ट फुड खान्छौँ इभन खाना पनि के खानै होइन भन्छ क्या ठोस खाँदा यता न्युट्रिसन भ्यालु नै खासै छैन अनि हामीले त्यो खानेकुरामा आफ्नो लाइफस्टाइलमा एक्सर्साइजमा हामीले फोकस गऱ्यौँ भने धेरै कुराहरू हामीले अभोइड गर्न सक्छौँ जुन कुरा आई थिङ्क हामीले यदि समराइज गर्नु पर्यो भने हामीले त्यही बुझेको छ नि आई जस्ट वान्ट टु थ्रो द्याट कमेन्ट टु एभ्रीबडी
हो नि एकदमै त्यही नै हो आखिरमा अब जस्ट लाइफस्टाइल मोडिफिकेसन टिप्स दिनुको कारण नै त्यही हो सो द्याट वी क्यान अभोइड एन्ड इभन प्रमोट आवर हेल्थ अनि अलिक केही नभए पनि जस्ट लाइक अहिले अब सबै कुरा गर्नलाई पनि गाह्रो होला होइन तर मेबी फोकस इन वान थिङ एन्ड देन मेबी नेक्स्ट मन्थ समथिङ एल्स होइन लाइक खानाबाट सुरु गर्नलाई मन छ भने खानाबाट अब अर्को टक्सिक हेर्न मन लाग्यो भने मेबी लाइक इन अ मन्थ अर टू लाइक स्टार्ट लुकिङ एट के कुराहरू टक्सिक छ कस्तो खालको क्लिनिङ कुराहरू छ होइन त प्लास्टिकहरू कतिको युज भएको छ लाइक दोज थिङ्स होइन सो नट बिङ ओभरवेल्म होइन टेकिङ वान स्टेप एट अ टाइम वान एस्पेक्ट एट अ टाइम होइन सो त्यही कुराहरू
Good. Asma Bhaini, Amar Bhai, any questions? Meera?
Sorry, मेरो त खासै क्वेसन त केही छैन एकदम खुसी लाग्यो आएर अनि धेरै कुरा बुझ्न पाइयो अनि त्यसपछि मेरो लागि पनि नयाँ कुरा थियो एन्जिलाले भने जस्तै नयाँ कुरा सिक्न पाइयो खुसी लाग्यो धन्यवाद माया दिदी हजुरको प्रेजेन्टेसन एकदम राम्रो थियो मेहनतको लागि पनि धन्यवाद मेरो थर पनि भट्टराई नै हो म चाहिँ आसमा भट्टराई हो सो क्लोज दिदी नै पर्नु भएछ धन्यवाद प्रेजेन्टेसनको लागि हुन्छ जयमसी
थ्याङ्क यू सो मच
भट्टराईले सपोर्ट गर्नु पर्यो नि Okay.
राइट आई गेस अब चाहिँ हामी ऱ्यापअप गर्नेछौँ आई गेस टाइमले पनि नेपालमा चाहिँ डाँडा नागिसक्यो भन्छ हामीतिर चाहिँ के भन्छ मलाई थाहा छैन लेट्स जस्ट युज द्याट डाँडा नागिसक्यो हुन्छ धेरै धन्यवाद थ्याङ्क यू अगेन माया दिदी फर दिस असम प्रेजेन्टेसन अनि थ्याङ्क यू दिपक भेना पनि फर गिभिङ अस द्याट एक्स्ट्रा कमेन्ट अनि एउटा डिफल्ट कुराहरू हरेक ठाउँमा स्पेसिफिकली डिफल्ट कुराहरू हुन्छ त्यो कुराहरू लाई पनि हामी सोच्नुपर्छ एउटै भेडे हुनु हुँदैन भन्ने कुरा जस्तो कुरा चाहिँ भेनाले पनि राख्नुभयो यस भेरी ट्रु अनि थ्याङ्क यू सबैजना जो आउनुभयो पार्टिसिपेट हुनुभयो क्वेसन्सहरू राख्नुभयो दिली दाई आई बिलिभ उहाँलाई चाहिँ पहिलोचोटि नै देख्दैछु म मेबी अशोक दाईले चाहिँ देखिसक्नु भयो होला सायद अरू इभेन्टहरूमा पनि बट थ्याङ्क यू सो मच फर कमिङ अनि अम्बर दाई निरा अनि गोफु आसमा चाहिँ सी इज अल्सो माई रुममेट एन्ड वी हेभ द्याट एको भइरहेको रिजन चाहिँ सी इज अल्सो समवेयर क्लोज अनि त्यही भएर एको भइरहेको सी इज अल्सो माई रुममेट अनि सी इज अल्सो नर्स एक्चुली रिसेन्टली अनि या आई गेस हुन्छ हामी चाहिँ ऱ्यापअप गरौँ अब अन्तिम प्रेयर चाहिँ आजको तिमीसी आजको एजेन्डा सरी हजुर अन्तिम प्रार्थना चाहिँ दिल्लीले हजुर पास्टर हुनुहुन्छ सरी पास्टर दिल्लीले उहाँले गरिदिनु होला
एकदम फेमस पास्टर हुन्छ
ए
अहिले गर्ने हो अब
हजुर
हुन्छ थ्याङ्क यू सो मच अनि मेरो पनि फेस अहिले एन्जिला बहिनी नयाँ लाग्यो अनि हाम्रो आसमा बहिनी नि होला बहिनी भने नयाँ लाग्यो अमरज्यूलाई थाहा छ अनि निरा थाहा भएन अनि दिपकज्यू एकदम खुसी लाग्यो यहाँहरूको बिचमा आएर एउटा स्पिरिचुअल कुरा मात्रै सिकिरहेको मान्छे अनि एउटा साइन्स क्षेत्रबाट पनि जाँदै गर्दाखेरि साह्रै खुसी लाग्यो अनि यसमा जोडिने इन्ट्रेस्ट चाहिँ के को लाग्यो भन्दाखेरि मेरो छोरी प्रेरणा पनि भविष्यमा डक्टर बन्ने अरे अनि उसको लागि म प्रार्थना गरिरहेको छु अनि छोरी बन्यो भने म एकदम खुसी छु अनि भविष्यमा म उसलाई पनि कनेक्सनमा राख्नेछु यस्तोहरू भयो भनेदेखि हाम्रो पास्टर अशोकज्यूले कनेक्सन दिनुहुनेछ मलाई जहाँसम्म लाग्छ अनि मायासँग कनेक्सनै छ अनि धेरै धन्यवाद यसरी राम्रो प्रेजेन्टेसन आज हाम्रो लागि असल कुरा तपाईँहरू जुन सिकिराख्नु भएको छ कुन कुन पोजिसनमा छ है अहिले नर्स भनेर सुनिरहेको बहिनी एन्जिला के गर्दै हुनुहुन्छ सोधिहाल्ने मैले माफ गर्नु
म चाहिँ रिसर्चमा काम गर्छु
वा ल म सही ठाउँमा नि छिरेछु प्रब्लम भएमा होस् थोरै प्रार्थना गरौँ ल हुन्छ प्रभु हामी तपाईँलाई धन्यवाद दिन्छौँ यसरी यो समय हामीलाई तपाईँ परमेश्वरबाटको ज्ञानलाई मात्रै हामीले सिकिरहेका थियौँ तर परमेश्वर आज तपाईँले नै दिनुभएको यी सबै स्रोतहरू तपाईँ परमेश्वरबाट आएका कुरा हुन् र प्रभु हाम्रो शरीरलाई तपाईँ परमेश्वरले कसरी सुरक्षित राख्ने कसैले स्वस्थ राख्ने भनिकन परम प्रभु तपाईँले हामीलाई त्यो ज्ञान र बुद्धि दिनुभएको लागि धेरै धन्यवाद दिन्छौँ अनि आजको यो भेलाबाट तपाईँ परमेश्वरलाई महिमा भएको होस् अनि जतिजनाले हामीले प्रभु आज सुन्न पायौँ सिक्न पायौँ अनि प्रभु यी सबै कुराबाट हामी तपाईँलाई धन्यको भन्छौँ प्रभु र आउँदो दिनहरूमा अझै यस्ता कुराहरू सिकिकन हाम्रो दाजुभाइ दिदीबहिनीहरू जसले आज साँच्चै नै आफ्नो स्वास्थ्यको बारेमा धेरै ख्याल गर्नु सकिराख्नु भएको छैन उहाँहरूलाई पनि परमप्रभु यो ज्ञानहरू हामी दिन सकौँ प्रभु तपाईँ परमेश्वरलाई धन्यवाद यसरी हामीलाई यो अवसरमा अनि परमेश्वर बुबा यो ज्ञानमा तपाईँले हामीलाई भरिपूर्ण पार्नुभएको छ अनि हाम्रो दाजुभाइ दिदीबहिनीहरूलाई प्रभु कसरी स्वस्थ जीवन जिउने भनिकन उहाँहरूले पनि त्यो कुराहरू पाउन सकेका हुन् प्रभु धन्यवाद आजको सम्पूर्ण यो प्रोग्रामलाई सुरुदेखि आखिरीसम्म तपाईँले हामीलाई सहायता गर्नुभयो अनि विशेष गरेर जो बहिनीहरू हुनुहुन्छ उहाँहरू पढिराख्नु भएको छ प्रभु उहाँहरूको जीवनमा आशीर्वाद म बोल्दछु प्रभु तपाईँ परमेश्वरले सधैँ प्रभु सुरक्षा दिइराख्नुहोस् अनि उहाँहरूको जुन योजनामा बढिराख्नु भएको छ ती सबै कुरामा तपाईँ परमेश्वरको अनुग्रह रहेको होस् अनि यसरी लामो समय पछाडि फेरि पनि पास्टर ज्यूसँग यसरी भेट्ने अवसर दिनुभयो हामी तपाईँलाई धन्यवाद दिन्छौँ र सबै कुराको लागि धन्यवाद मायालाई अझै प्रभु तपाईँ परमेश्वरले ज्ञानमा बुद्धिमा कदमा तपाईँ परमेश्वरले अझै बढाएर लानु भएको छ। अनि हाम्रो साँच्चै नै नेपाली दाजुभाइ दिदी बहिनीहरूको बिचमा पनि परमेश्वर तपाईँले एउटा तारा जस्तै बनाइकन प्रभु उहाँको जीवनबाट तपाईँले महिमा लिनुभएको होस्। प्रभु तपाईँलाई धन्यवाद। अनि उहाँको 3 जना छोरीहरूलाई तपाईँको हातमा राख्छौँ, श्रीमानलाई तपाईँको हातमा राख्छौँ र प्रभु सबै कुराबाट तपाईँलाई महिमा भएको होस्। प्रभु धन्यवाद। यसरी निरा अनि प्रभु यसरी आसमा बहिनी, एन्जिला अनि प्रभु दिपकज्यू अनि अमरज्यू जतिजना यसरी प्रभु अनि पास्टरज्यू अनि माया हामी सबैलाई प्रभु यसरी बहिनी ज्योतिलाई पनि कनेक्सनमा राख्नु भएको थियो। प्रभु सबैलाई तपाईँ परमेश्वर आशिष दिनुहोस्। धन्यवाद। अब हामी सोध्छौँ कतिजना काममा हुनुहुन्छ उहाँहरूको जीवनमा तपाईँ परमेश्वरको सुरक्षा रहेको होस्। धन्यवाद चढाउँछौँ यसो तपाईँको उच्च अनि पवित्र नाममा। आमेन आमेन
आमेन। जय मसीह सबजनालाई।
Thank you.
Jai Masih.
Jai Masih.
Thank you so
Jai
much.
Masih.
Thank
Jai
you.
Masih.
Thank you,
Thank you.
Pastor Lee.
Bye.
सबैजनालाई ल थ्याङ्क यू।